Federal health officials now say we could be facing the end of the road for antibiotics. For the first time, someone in the U.S. is carrying a bacteria that can't be treated with an antibiotic that's often used as the last resort. Colistin is the drug used to fight dangerous types of superbugs, and according to a study published Thursday, a woman in Pennsylvania has a strain of E. coli that's resistant to it. Dr. Roshini Raj is a gastroenterologist at NYU Langone Medical Center and joins me now. All right, so Dr. Raj, this is really alarming for a lot of people to hear this, but can you just explain what this means? What are the possible ramifications if this bacteria spreads?
Sure. So this particular bacteria is resistant to one of the last resort antibiotics that we have, colistin. And the ramifications are for other infections, for other people that have resistant bacteria that are resistant to many antibiotics. If this last resort antibiotic isn't going to work, then we're in major trouble, and certain infections that used to be treatable may become untreatable. Things like urinary tract infections, surgical infections, pneumonias. If we don't even have this last resort as a last resort, then people are going to die from infections. Now, in this particular case for this patient, the good news is her strain of bacteria is treatable with some other antibiotics. But the fact that they tested it and found it was resistant to the colistin is very serious and concerning.
Do researchers know yet how this woman contracted the bacteria?
They don't, and that's what they're really looking into actively. The only information we really have is she did not travel for the last several months, so most likely she did contract it here in the U.S. And they have isolated a similar resistant strain in some pigs here in farms in the U.S. So there may be some connection with antibiotics being used to treat livestock and then these resistant bacteria being transferred to humans in that way.
So explain to us what this colistin is and how is it used?
So this is a pretty old antibiotic, but it's being used these days to treat infections that are not able to be treated with our more modern, really strong antibiotics. So it is considered one of those last resort antibiotics. If you have a particular infection, you're in a hospital and they've tried every other type of antibiotic, this one usually will do the treatment and really cure the patient. However, it does have some strong side effects as well. But the fact that this particular strain of E. coli was resistant to it means that in the future there may be other bacteria that also become resistant to it.
So bottom line here, what does this mean for the use of antibiotics and people who depend on them?
Well, it's a growing problem that we've known about for a while, and the White House has recognized that as well. And this is just one more piece of evidence that we really do need to be concerned about this growing resistance to different antibiotics. And in this case, it's the most concerning case we've seen so far because it's resistant to the most powerful antibiotic we have for those difficult to treat types of infections.
All right, Dr. Raj, thank you so much for that.
Thank you.
Appreciate it.